Hey guys, Dr. Alex Ritza here, and if you've got sore knees, a knee injury, your knees feel weak, or you generally just want to protect your knees, this video is for you. We're going to be talking all about using a hip strategy instead of a knee strategy to save your knees. So guys, I'm Dr. Alex Ritza. I'm a neurostructural chiropractor practicing at Park Road Healing Arts in downtown Toronto. And in this video, we're gonna go over some drills that you can do at home to strengthen your hips and to take the load off your knees to save them in the long term. So a small preamble before we get into the drills. Some good research has been done down in the United States and in Canada by a lot of great researchers. Specifically, Dr. Chris Powers at USC has found that people who tend to have knee injuries in general or in running tend to use what's called more of a knee strategy than a hip strategy. A knee strategy means that when they bend the knee, when they put body weight into their body, they tend to absorb more force into the knee or into the muscles around the knee. And whereas the people that tend to have healthier knees that get injured less, they tend to absorb more force and put more weight onto their hips and onto the bigger and stronger glute muscles. And what we have found through the research is that if you can retrain your body to move so that you load the glutes more, and if you strengthen the glutes, that over time your body will tend to adopt more of this hip strategy, putting more weight onto the bigger, stronger hip and glute muscles, which is going to take load off the knees, is going to limit the amount of force that goes into them, and is going to help deal and prevent with injuries. So today we're going to teach you how to transition to using a hip strategy to save your knees. Guys, no time like the present, let's get into it. Okay guys, so how do we know if we tend to use more of a hip strategy than a knee strategy? Well, unless we go into the laboratory, we're gonna have to take some guesses. So one guess is if you try the exercises at the end of this video and you find them difficult to hold for a minute, probably reflects that you have more of a knee strategy and that the hip and the glute muscles are weak. But here's a couple of things that you can do to test yourself. So number one, if you practice doing a squat, normally the buttocks should come back, we load up the glute muscles, and it's like we're gonna sit backwards into a chair. If you tend to find yourself more like this over top of the knees, knee strategy. If we're doing a lunge and we tend to really shift forward onto our knees, knee strategy. It should be more straight down using the glute muscles. If you try those things, try the drills at the end, the exercises, and you try a squat or a single leg deadlift, a single leg squat, and you find there's lots of pressure on your knees, probably using a knee strategy. Or if you've got achy, sore, injured knees, probably a knee strategy. So what we need to do is we need to retrain ourselves to use our glutes and our hips. One of the first things we're going to do is we're going to practice our squat. And the best way to learn to develop that hip strategy, especially with a squat, is to practice sitting down into a chair because that's going to load up the glute muscles. What we want to focus on, hands across our chest. And rather than squatting down over the knees, we're going to sit back and almost fall backwards into the chair, bend forward through the hips, come up, tighten the glutes at the end. And as you slowly practice this more, you can go slower and slower down into the chair, putting more and more weight into the glutes. And as you get more comfortable, you can take the chair away and work on squatting down as low as you can, putting more and more weight onto the glutes. Same thing with the single leg squat. Practice putting more weight onto the glutes, coming straight down. That's going to help retrain your body away from that knee strategy and towards more of a hip strategy. So next we're going to go over a couple of simple drills that you can do to retrain your body to adopt that hip strategy rather than a knee strategy to save your knees. So another drill that we can do to retrain that single leg lunge to develop more of a hip strategy is a single leg lunge, but putting our rear foot up and elevated and making sure that rather than shifting forward, we're going to shift straight down, loading up the glute where the weight is being bared. So work on both sides, work on keeping the weight over top of the middle of the body and the glutes as opposed to shifting forward over the knees. So the exercises we can try to reprogram our knee to a hip strategy and strengthen our glutes, and that I also mentioned are a good test for your glute strength, is a side bridge progression. We've gone over this before. We're going to do it one more time. We get down on our side. We're in a short lever position with our knees on the ground, and we're going to prop ourselves up. Ear, shoulder, hip, and knee are totally stacked up in line, and we're going to work on holding the following positions for 1 full minute. So we'd work on folding or holding a side bridge, 1 minute. A side bridge with a clamshell, 1 minute. A side bridge with the leg abducted or lifted straight out and a little back, 1 minute. And so if you can do these 3 drills, holding them for 1 minute, alternating between sides, that is going to be a great way to strengthen the glutes and strengthen the hips, and generally reflects pretty good core strength. The other 2 drills, we're going to need a TheraBand. Okay guys, so we've got our resistance or our TheraBand on. We're going to do what's called a monster walk. Our monster walk, we're sitting back with our glutes, and so we've got our TheraBand on, and we're going to work on shuffling to the side, pushing the leg straight out, sitting down, a nice controlled motion, and shuffling 10 paces back and forth. I've got this around my thighs. If you put it around the feet, it's going to be even more challenging. One more drill that's similar is we're going to do a modified monster walk where we're going to shuffle, but we're also going to extend our leg straight out with some rotation, and then we're going to rotate into place. And then we're going to shuffle, out into rotation, change place. And so what you can see is we're going in a circle here, leading with this hip, externally rotating it. Another way you can do this drill is when we extend the leg out, and we can also bring the leg forward, and you can also do this stepping up onto a bench. But I like going in circles. So guys, try these drills. They're going to help to develop a hip strategy versus a knee strategy. In the long run, it's going to save your knees, especially if you are a runner, or if you do a sport like skiing. Do these exercises, put the weight onto your glutes, save your knees.